to
Sure,
share.
sir, sure. And looking at your expertise and the domains you have worked for, so would like to know what is your vision for this sector in coming, say, 5 to 10 years.
So my vision is always, at least for two things, that if we can improve the affordability, because as I said, I've seen that quality is poor, people are poor, people don't have money because they are poor, they don't have money, and quality is poor, so even others are not putting the money. And so my thought has always to work so that we are able to improve the quality of care and provide those quality of care at the doorstep to the every nook and corner of the country, so even needy can afford it. And when they have, and they not only afford the healthcare, but they are able to afford the best quality of care in the country. So that is what improving and providing affordability and accessibility. And to how to do that is, of course, technology has the important role. So that is what is, I think, uh, it should be for health system.
Okay, sir. And okay, just a second. And in your view, in your areas, domain areas, can you tell us, are there any milestones still remain to be achieved?
So you mean to say, uh, overall in general, we were talking about the personal milestones.
No, general. The you said you work in quality, you work in say research. So are there any milestone we should be aiming at?
Yeah, so there are many things which we
Hmm.
still be working on, and of course one of them is, of course, these days I'm reading, and we all know about that the cost. Somehow we started as a kind of a social nation, so with more of the social activities. But then again we opened up market, and then we went into market oriented interventions and all that. So we started with the UK system because we were colony of UK, and then slowly we started adopting the and the US system, which is market oriented system. So we see that, and these two are very contrast. So what I see is right now is that the quality, because of privatization, the cost of care is going tremendously high, and it is going beyond. It is just like at some point of time it will actually become chaotic. Nobody can have affordability because the uniformity, there is no uniformity of cost or the price of healthcare in different part of the country. So I think that is one thing I feel is really challenging part, and where we is something has to be ensured that we are able to provide the best quality of care in every part of the country. At the same time, the how to reduce the cost, or if you are not reduce the cost, I would say how to rationalize the cost, that it is affordable to everybody. So I've been talking. So what I'm saying again, same thing, because now every what I see, and you would agree, everybody would agree, that the costing is actually becoming abnormally unpredictable. Every year, cost is going up, and there are reasons for that. I'm not saying that rise in cost is have no basis for that, but it only point I want to say is that where we should be working, everybody should working, public, government and public authorities should be working, is that increase in cost has to be, there has to be some rational behind increase in cost, and make sure
Sure, sir.
that the care is available to everybody. So
Sure,
that is
sir. Sure.
one thing.
Hmm.
Still, it is still uh, far-reached aim, and still we need to work a lot.
Sure, sir. And so coming to our last question of the interview. So with your broad experience and first-hand experience, what is your message to our young graduates in the development sector, sir?
I think that I've seen that in young development sector, in the people start right from the beginning, they start looking for the money, that their salary is less and all that. I think first thing is that, as they say, in the beginning you should not focus on the money, it should be focused on more on the learning part. So that is the first kind of mantra which I have been told by my seniors, and their seniors have told me, I have told to them, and which I really feel that these days people want a shortcut to go higher up and just get the more higher salaries or better positions. But it is the time they spend in the ground level, the time they spend to learn things in the early of the career of their life, is what going to help them improve. I mean, help them acquire more laurels also, at the same time the better salary, and they would be able to take a big roles so that they can make an impact in the society. So a small contribution can create a meaningful change, but for that they have to first arm themselves with the real skill set, which will only come by spending time in the rural, interacting with people, being curious and empathetic and persistent for a long time.
Yes, sure. Thank you, sir. And to this, we come to the end of our interview. And thank you, sir, for giving your valuable time and sharing your insights and your learning with all of us, so that not only the young graduates, but the community, outside the development sector community, they also know like what is happening in this sector. And there are like people stalwarts like you. We have like spent around 3 decades in this sector. So thanks for sharing, sir.
Thank you so much. And I think do one of the area I still feel is that role of technology into health system and AI and all that. So I would ask you also. You have been very technology oriented, so we must do something about training people about the AI or technology, so that we can improve the efficiency of the people, even young or senior level, or even the community people, how to seek, when to seek the healthcare facilities, how to access the data and all that. So let us work on that, because that is something, is a collective responsibility of all of us. And thank you for having me here today, this evening. And thanks again, and best of luck to your such efforts.
Thank you. Thank you, sir.
Thank you.